Welcome to the Produce Moms Podcast, where we believe there is a produce mom in all of us. I'm Lori Taylor, founder and CEO of the Produce Moms. For 10 years, I sold fresh produce to over 300 grocery stores in the U.S. And today, my team and I are fully focused on inspiring people to eat more fruits and vegetables. This show is just one of the ways that we hope to inspire you and your family to eat more produce and live a better life. If you like what you're hearing on the podcast, join our community of almost 40,000 in all 50 states and over 30 countries by visiting theproducemoms.com/subscribe. And be sure to subscribe and leave us a review on iTunes. Thanks for being here. Enjoy today's show. Welcome back, everyone. Today on the Produce Moms Podcast, I'm welcoming one of my dear friends, a true industry legend and champion for all things nutrition, wellness, produce, supplements. I mean, you name it, this girl is the queen. She was episode 6 of the Produce Moms Podcast. And she is here today to talk about her new role. She's vice president of business development at Baze. Baze is a company with the ethos of the future of nutrition is personal. And they are the future of nutrition with their supplements that are all done based off of their patient's blood work, and they make the process so simple. I am a Baze user, and I mean, I just could not be more thrilled to welcome back Allison Baker, dietitian and 100% superstar, to the show.
Thank you, Lori. I am so excited to be here, and my street cred for being episode 6 and now episode like 480. So very, very proud of you and the Produce Moms and how the podcast is going, and very, very honored to be here to talk about kind of this new venture in my career and sort of in my journey with nutrition and health and wellness and everything that is a part of that.
That's right. And I mean, Allison, you have really been a catalyst for my understanding of the fact that nutrition is such a personal journey. And it's more than that. Like scientifically, it's so personal. I know that you attended many of the 2020 Dietary Guidelines for Americans meetings and task force sessions. And one of your pieces of feedback that you offered me and others was, nutrition is so personalized. This is tough. And, so let's kind of just start there. Explain what Baze is and this concept of personalized nutrition.
Yes, absolutely. So, kind of in my former life when I was in the grocery space, personalized nutrition was definitely something we talked about. We talked about it a lot in the context of like grocery data and helping people better understand their shopping. But there was also this kind of like understanding of what it was in the outside world. And I honestly had a very probably limited view on it of that time, where it was like microbiome and DNA testing. And that was kind of like how personalized nutrition was being labeled in the industry. And then when I learned about Baze and connected with them, I was really astounded because it was taking, much more evidence-based, actionable methods, which our primary method that we use today is assessing blood nutrient status, and putting that into this personalization engine that really made it just as technical and exciting and cutting edge as some of this microbiome and DNA testing, but honestly, way more evidence-based and way more actionable than really any other method out there. And so what we do at Baze is we seek to optimize blood nutrient levels. So right now, you may be wondering, do I get enough sunlight? Do I have a vitamin D deficiency? I'm vegan. Am I getting enough B12? Or just in general, does my diet support the micronutrients I need to be healthy? And you really have no way of knowing that today. You can kind of track your intake, and you can maybe get some limited lab testing through your doctor, but there's high cost with that. There's high time investment. It's not convenient. And so what we do is actually an at-home blood collection methodology using a really innovative blood collection device called a TAP device. We just got FDA approval on that, virtually painless. Ship it back to our lab in Boston where we prepared the sample. And then we have developed, actually with this really amazing lab in Switzerland, this process, this kind of, protected intellectual property of how to use a 100 microliter sample and use mass spec to test for all of these different vitamin and mineral levels, including omega-3 fats. Then you get a personalized report and then personalized monthly packs of supplements that help you through our dosing algorithms basically get to those like perfect level, those sweet spot levels we call the Baze zones, where research actually says this amount of vitamin D in your blood correlates with this outcome. It's not just about an average or a population average. It's literally how do we optimize this simple but powerful metric, which is blood nutrient levels. So it changed my definition of personalized nutrition. It definitely brought it way back in the realm of very strong science, very strong evidence, and very strong actionability. And so that to me made it this beautiful platform that, from this testing methodology, this analysis methodology, these dosing algorithms, all of the stuff can happen on the back end, right? With food, supplements, you name it, agriculture, just building a world where we're meeting people's nutrient needs and optimizing them.
Yeah. And I definitely want to emphasize what you just said about the blood collection, the proprietary process and device that you have to do that at-home blood collection. You emphasize that it's virtually painless. And I want to tell folks, it is completely painless. Like I had to make sure, I had to utilize the little color code because I couldn't feel it or anything. And then luckily the color just changes on the device to tell you okay, you're done,
right.
So,
right, exactly.
Yeah.
A lot of times you see a finger stick and that is painful. I'm a baby. I've done, other tests when I was vetting different things at other points in my career. And it's just not enjoyable. You have to squeeze the blood out. You have to see it. You have to kind of capture it. Our device, first of all, it takes a little bit more blood, which is great. So we can do more analysis, but it's really cool. It's like a little pod that goes on your arm. You depress this, you push this button. Like you're saying, you don't really feel anything other than just like something's happening, but you're not sure what. Right. And then you just pop you pop basically this cap on the bottom. You don't have to mess with anything. And then you put it right back in the box it came from it and you ship it to our lab. So incredibly easy.
You don't see a needle either. There's no visible needle. Yeah.
There's not. And it's not just one needle. It's actually a little array of micro needles. And that's why that combined with like a gentle suction, that's why it's really painless. But it's such a novel technology. And it's like, again, it's taking these tests that, when I was in the clinical space, we would sometimes do them for patients, but it's very hard to get that ordered. And we would only be looking at 1 or 2 nutrients most of the time. It's taking that and just putting this in the hands of people. They're taking control of their own health and they can make informed decisions. So It's really this beautiful window into, your status and, quantifying your own health.
Yeah. And, in the same way, people like to put their monogram initials on their cufflinks or their business planner or their travel bags or, even their rain boots. There is something very inspiring and joyful in seeing I have my Baze vitamin box right next to my coffee pot. And
so do I.
Yes, I know it's perfect. I'm going to the coffee pot every day for sure. So, and then you tear off, they're like these little pillow packs it's a roll of your vitamins and they're all personalized. And it's like a little pillow pack and one a day you tear off and it says Lori's vitamins on it. And oh my gosh, it just makes me smile. So, I do love it. I love checking in on the app as well to see where my nutrient levels stand. I like that after 3 months, part of the process is to do the at-home blood test again so that you can, you got to measure the improvements. You have to see that data as a user to stay motivated,
Yeah, it's so important because not only is it helpful for the user to see how they're improving, but it also makes our algorithm smarter for that person. So, one of the things about genetic testing and personalized nutrition is they'll say, well, that your genotype will tell you if you're like a high or low responder. Like you may need more vitamin B12 in order to get to a certain level. That is interesting and definitely an input that, we'll definitely incorporate in the future as that science evolves. But the fact is today, you can tell if you're a high or low responder from test 1 to test 3 or test 2. So month 1 to month 3, you can see that change and you can understand. And our dietitians approve every dose before it goes out the door. And so we can actually look at that and have that as an input into the algorithm to just get smarter over time. Right. And it's just so critical. And so on that point though, we recently got our impact data back for 2019. And for all of our users that went through our process and did test 1 and test 2, by the second test, we had closed 73% of deficiencies. We'd either move them from into normal or into optimal 73% of the time.
Wow.
And that has honestly, it's never been done in the industry, in part because other interventions are not being measured, but
Right.
it's literally just never been done before. And so, we're saying we're closing the gap. We have the data to show that we're closing the gap. And today we're doing that with supplements, personalized supplements, but we definitely also see a future where either on our platform or by partnering with others to leverage our capabilities whereas they own kind of that back end intervention, it's really cool to think about what the possibilities could be.
Yeah. I mean, and this is amazing. I mean, it's the program, the Baze program is so unique. It's so special. And really for anyone who has had to invest in blood work through their doctor, it's a bargain. Oh my gosh. Like it's such a bargain. Yes.
You're talking a black box when you go to do this in kind of the healthcare system. Some of the nutrients we test for are just not commonly tested for because, again, our healthcare system is all about treating disease after it happens, like treating a vitamin D deficiency after you start to see symptoms. And so there's not this focus on preventative wellness or like optimization. So when you go, if you went to your doctor and you said, I want to be tested for these 10 things, first of all, you would probably get a bill that you would not want to see the numbers on it. And secondly, it's not even necessarily very accessible. So when you think about, we, have a $99 starter kit that, we'll run different promos on and things like that. It's really crazy. And then the supplements on average, you may be saving anywhere from $20 to $30 a month versus if you were going out and buying all of the supplements individually. We have really great pricing on that. So accessibility and affordability are two really important principles we have at Baze. And so you can definitely see that coming through in the product.
Yeah, you can always, and I mean, truthfully, you guys head over to baze.com, BAZE.com, and there's a good chance that there's some sort of promotion going on. I feel like there's always great offers and promotions that you all have. And I love that. I mean, I think it's so important and, to get people into the system and to trust the process and understand. So let's talk about, Allison. I mean, why are supplements even necessary? I mean, we are here on the Produce Moms podcast and, the vast majority of our broadcasts are talking about eat more fruits and vegetables. We really aren't the type of company that's going, you wouldn't think that we're the type of company that's going to say, take pills, there is an exception here. And you, as well as, me being a Baze member are reasons why my mindset has significantly shifted in this space. So please share some thoughts with our listeners today, why supplements are necessary.
Yeah, this is one of my favorite things to talk about because I also had this journey in researching and then joining and then learning how to grow Baze. I'm a dietitian by trade. I haven't worked in that capacity in many years, but the training is very much, food first. And essentially it's, everything you need, you can get through food. Now, let me just say, food is critical. I mean, food is literally, you can't live without it. It is the foundation of everything that you do. And its importance cannot be overstated. That being said, what the data tells us is that we, from a food perspective in the U.S., underconsume every single micronutrient except for sodium. We are not hitting the targets even half of the time when it comes to most of these critical micronutrients. And then another thing to add on that is the targets that we set as a public health community are not aimed at optimization of your blood levels by any means. They're typically aimed at just avoiding deficiency. So when we actually look at what the literature says is an optimal blood level, not only are we not eating enough to get halfway there, we're definitely not eating enough to get all the way there for the most part. Now, that being said, we're not having people come back with every single nutrient non-optimal. Most people have a few that are, but everybody has some that aren't. And so the role of supplements is just that. They are supplements, but they are critical because they close the gaps. The other interesting stat, Laura, you mentioned like your users or your viewers, maybe not taking supplements. Actually, 73% of the U.S. takes a multivitamin, and 1/3 of the U.S. still has a nutrient deficiency.
Wow.
So when you think about that, it's like our current approaches to eating and supplementing are broken. we're doing everything in a blindfolded manner. We're taking a multivitamin, we're trying this supplement for this particular concern. We actually, it's crazy when you think about it. We have no idea what we're even targeting. We don't even know what we need, but we're taking and spending a lot of money on these supplements. And the data, when you layer it together, we know we're not eating enough. We're not even eating enough to be average most of the time, definitely not optimal. We're taking supplements like crazy, but that's not helping. And at the end of the day, we still have 33% of the U.S. with one or more deficiencies. That's not acceptable. We've got to figure out a way to get people's own data into their hands, get them the right foods and the right supplements so that they can optimize. It's like more than time to take that step and change the way that we approach this.
Yeah, 100%. And technology has really empowered this whole journey. I mean, that it's so fascinating to me. And I actually just read an article in CNBC, and I think I texted it to you, Allison. Personal nutrition. Okay. you know where I'm going with this. Okay, you guys be prepared because $64 billion industry, right? These stats are incredible. Personal nutrition is being touted as the next plant-based meat industry with an estimated worth of $64 billion by 2040.
With a B.
With a B. And that's just 2040 is just 20 years away. Like, this is incredible. Yeah. So, I mean, what are your thoughts?
Well, I mean, first of all, it's exciting. And just given, my overall work in this industry, it like warms my heart to some extent because I have done everything from counsel patients individually many years ago to build organizations that do that to now working, just to bring this amazing technology to the market. And I've had that evolution in my own career. I mean, just seeing people that are wanting to change or wanting relief or wanting a result or whatever, having been so frustrated by generalized advice that hasn't worked for them. And then what they do is they typically give up. They just give up on the journey. And this can be even outside of micronutrients, something like, telling people just eat more fiber when they have certain intolerances and their situation just gets worse. Or someone getting a vitamin D test that's low at the doctor and getting a kind of a generic dosing recommendation and never following back up on it again and honestly forgetting about it and then being in the same situation 3 years later. Like, if we don't get personalized, we are going to lose so many people that otherwise would be life changed, right? And so to me, it's very personal in a sense. Like, this is what we need to do for people. It's also very exciting because, like, I explain personalization in this way. It is that beautiful moment in healthcare, in wellness, when you have someone's attention. Like, they've dropped what they're doing. They're looking at some sort of data that represents them and who they are and their health. And now they're listening. And now they're paying attention and they're looking to you as that, in our case, to Baze as that trusted partner to say, okay, what do I do now? And like, from any kind of like, whether you're in marketing, whether you're in merchandising, whether you're in healthcare, like, that's the moment that when you've got somebody like that, that's when you can make an impact. And so the fact that is going to happen more often through more solutions, and we're going to see, hopefully some of like partners that we hope to work with capitalizing on that to help people with their products. We're bringing them the consumer in that moment, right? And then they are able to take that moment and do something amazing with it. Like, that's how we see Baze moving forward, is bringing folks to that beautiful moment of attention and learning about themselves.
Mm-hmm. That's so good. You are such a pioneer in this space, and really Baze is as well. I know Baze is a young company. Baze is also a global company. But this is, you guys really you're just so well positioned to make this concept and truth of personal nutrition accessible for all. I mean, it's really phenomenal. Yeah. So let's talk a little bit now, Allison, about how people feel when they take vitamins. I mean, I know that you said these results that you shared. Could you please share those again, the deficiencies that you were able to?
Yes. Yeah.
Okay.
So 73% of deficiencies that we discover in the first test are corrected, either normalized or optimized by the second test, which is 3 months later, 12 weeks
Yeah.
later.
Yeah.
And so the things that people report on, they feel more energy, more focused. Some people will say, like, I got sick all last winter. This winter, my family was getting sick. I was, perfectly fine. There's interesting data around even a lot of other areas or spheres where nutrient optimization can be helpful. Everything from skincare to weight management. So when you diet continually, you actually really chip away at your micronutrient levels and your micronutrient foundation, which makes it harder for your metabolism to work effectively and manage your weight.
Mm-hmm.
So there are a myriad of benefits, and people will report a lot of different things. But the one thing that I think is not necessarily something you feel right away, but is this insane benefit. There was a study that came out, a really large meta-analysis fairly recently within the last couple of years. And they looked at, in this instance, vitamin D supplementation, two ways of approaching it. One was just blind supplementation. So we're giving everybody, kind of a standard RDA amount. The other one was supplementing to their blood levels, giving them what they needed based on their level of deficiency or non-deficiency and working towards optimization. This study in particular looked at really what is the ultimate measure of health, which is mortality, right? So like actual longevity. It was a long study, a large study. And what they found was in just the kind of general vitamin D supplementation, still a positive result, 3% reduction in overall mortality. When the blood levels were optimized for vitamin D, 30% reduction in mortality, 10x of just doing supplementation in a blindfolded fashion. So I think you'll see a lot more research about this coming out, especially as personalization picks up steam. But there's already a really great body of literature. I mean, we look at hundreds, thousands of papers in terms of our nutrient information system and the capability that we build to really say what's the optimal range first, what's the Baze zone in the blood, and then how do we get you there through this right dosing protocol that's taking into account all of these variables. And so there's really great support for how that can help somebody literally have a longer and better life.
Yeah. I mean, it's got to feel good to do that work because the numbers never lie. That is some phenomenal statistics and data that just truly are making the world a better place, So what about people like me that aren't good about taking pills every day? Because, I've also texted you about how, hey, it's time for my
I know you're every 3-dayer.
Yeah, it's time for my month 3 bucks, and I'm still not even halfway through month 2. But
no, I love it. I mean, honestly, you're not alone, and we've talked a lot about this on kind of our product side. Is how do we give our users some more flexibility in that routine, whether that's like pausing, your box for the next month, or just understanding that some people may opt into that type of protocol. So there's really no necessarily like issue other than it will just take a bit longer to optimize. So when we built our algorithms and our dosing protocol, we had that target of like within 3 months, we should get you optimized or very much on your way.
Yeah.
If it takes 4 months, 5 months, because you're more of an every couple day or every 3-dayer, there's really not a loss there. We hope to, work with our users for a long time. So yeah, trust me, you have given great feedback there. So have some other folks, even some folks on our team. So we're working on that. We actually, we really have a focus on product over this next, 6-12 months. And so I'm excited to see some of the new things. And then on the partnership side, Lori, I wanted to make sure you knew about this. I think from a produce industry standpoint and just a food industry standpoint, this is really interesting. We actually partnered recently with Eat Local. So they're an amazing prepared meals provider out in Seattle. They also have an e-commerce business.
Yeah,
and they put together a week. They're amazing, and they have such wonderful reputation in the community. They've put together a week's worth of meals. So breakfast, lunch, dinner for 7 days, 21 meals. It's called the Essential Nutrient Sampler. And what we've done is we've taken our most commonly seen deficiencies at Baze in general. We've mapped those 4 micronutrients back to their meal assortment. And we've come up with a bundle that targets the most likely deficiencies that you will see when you are doing Baze testing and working with supplementation. So we're starting to really literally bring food into the picture. That's available on their website, eatlocalonline.com. It's 20% off through the end of February. But look for, we're also having our kits are also available there on their site, but it's the essential nutrient sampler. And it's basically like you can start deploying those vitamins, every day or every other day.
Sure.
And then the meals, right? Every day or every meal, or stretch that plan out over a longer period of time. And now we're literally talking about a 360-degree solution, testing, supplementing, and food.
Right.
I mean, this is like the dream scenario for someone who's trying to optimize their nutrition. I mean, and convenience. We're talking open up a packet of pills, right?
Mm-hmm.
And microwave a prepared meal that's made with, so you'll love this. Like every dish has mixed greens to some extent, produce focused, really impeccable nutritionals, and building up that base of micronutrients.
Yeah, it's amazing. If you are in the Pacific Northwest, make sure you check that out. Sounds like an incredible collaboration, and one that I hope is a model for nationwide, partnerships and solutions like this.
Definitely.
And, and also in December, maybe it was early January, December, during the winter, I definitely appreciated the promotion with Monterey Mushrooms as well.
Yes, that was so much fun. So when I was at Kroger previously, we had done a couple of things with Monterey Mushrooms because they have this amazing fresh mushroom product that's exposed to very, specific, calculated levels of UV light, and it causes vitamin D production in the mushrooms to increase. And you're looking at a 50 to 100%, daily value of vitamin D in the mushrooms. So we sent out almost 500 vitamin D mushroom coupons and informational flyers in all of our kits and supplement boxes around the holidays. So exciting. We did influencer partnerships. We published a blog all about this idea. And it was really, we said, like, from supplements to saute pan, we've got you covered.
Right.
Because it's really just about how you get that vitamin D and that tough seasonal, drop in sun exposure and sunlight. And so it was really and Lori, you were so helpful in kind of setting up that collaboration for us. It was so cool to see the agriculture industry, which is near and dear to my heart, pair up with this personalized nutrition, like nutrition technology, kind of cutting edge area, because they're also using cutting edge technology in the ag space. So like bringing it all together to help people and raise awareness. We got comments on Instagram like, I had no idea mushrooms could do this. Like these are the only types of mushrooms I'm going to buy now. So it was really, really cool to just raise that awareness amongst our customer group about this amazing option within produce.
Yeah, I think it's a natural collaboration, and was really happy to see that come together. And just, I believe so much in what you're doing and what your company stands for. And I think that those collaborations with food industry stakeholders demonstrate that Baze is really focused on the mission. I mean, that's
Absolutely.
Yeah. And I just think that's so important. Like this is a company that cares about the end result to the point where they are considering and actively collaborating with, with complementary industries. But, I mean, hey, selling more mushrooms doesn't necessarily mean you're going to sell more Baze kits, So it's really cool to see how authentic the Baze company is. And I really appreciate that as a customer.
Well, thank you. I mean, the fact is we have to help people within this whole ecosystem. I mean, there's supplements, there's cooking from scratch, there's times when you need prepared meals, there's grocery delivery, eventually there's eating out. But like this is my firm belief, and kind of like to the mission point first. I couldn't agree with you more. It is about the bigger, bolder purpose. We say that really the whole purpose of our brand is to empower individual wellness for all. And that's like just such a powerful kind of concept to think about, individual wellness, but for all, and empowering people to take those steps. And what I really believe about nutrition, and this is from years of kind of deploying different solutions, some that worked, some that didn't. We focus so much on eliminate sodium, eliminate saturated fat. No, don't eliminate saturated fat. Well, coconut oil is okay. No, it's the devil. And this is what we focus on. And this is where all the dialogue is. And it's not surprising that people are like, I have no interest in that. I do not want to be told what I need to cut out of my life, especially when it's changing all the time. The actual truth, and there is research to back this up, if we just focused on eating the micronutrients that we need to be healthy, so we flipped the script and we stopped talking about the stuff to avoid, and we started talking about, you know what, magnesium is a gap for me, selenium is a gap for me, omega-3s are a gap for me, and we just started eating towards that and then supplementing appropriately and smartly, it would change everything. And that's like my, message to this whole community is, let's stop talking about the demon ingredient of the week, and let's start talking about these micronutrients that literally fuel every chemical reaction that happens in our body, whether it is metabolism, whether it is disease prevention, immunity. If we just focus on what we need and not what we don't need, it would be a better experience for everybody.
Amen to that. So we gotta tell folks where to go to learn more. I mean, you have to go to baze.com.
Yeah.
And Allison, I can't thank you enough for educating me and opening my eyes to what personal nutrition is all about. I'm thankful for your employer and your company, because I do feel healthier after, being 3 months into my journey as a Baze customer. I absolutely feel better. My skin looks better. And I'm thankful for that. It makes your life better, folks. And so, Allison, thank you for being here. We have a tradition which you're well aware of. You get the final word. But I just want to say thanks for being here, and you can say goodbye and any final thoughts to our listeners.
Well, thank you, Lori. I mean, just the work that you're doing in this space and in this industry is so amazing. Just really appreciate your support, your advocacy, your endorsement means a whole lot. So very much appreciated. And I really think my message is this is attainable. This is really no longer the future in a sense. It's the future of personalized nutrition is now. And so we're just excited to be part of that for people. So thank you, Lori, and always a pleasure.
Thanks for joining us on this episode of the Produce Moms Podcast. If you or someone you know would like to be a featured guest, just send an email to lori@theproducemoms.com. We know there is a produce mom in you because there's a produce mom in all of us. Join our community on Facebook and all social platforms. Help us change the way America eats. Thanks again for listening, and we'll see you next time.